At Advanced Chiropractic Clinic in Ennis, County Clare, we are a multidisciplinary clinic that deal with all issues of the body, whether it be musculoskeletal neurological complaints, which the chiropractors would deal with. We also have on staff 2 nutritionists, a massage therapist, a homeopath, a bioenergist, psychotherapists. We offer the full range of health services under one roof. And if you're seeing one practitioner and they feel that you might benefit from another, then they can arrange for consultation with the other practitioners, and we work as a team to improve your health. The different kinds of conditions that we treat as chiropractors, I'll talk about specifically, are anything from shoulder pain, arm pain, leg pain, low back pain, sciatica, shin splints, foot pain, neck pain, headaches. We deal with any of those physical complaints that people are having, whether it be an acute injury due to work or a sports injury, or whether it be a chronic complaint that you've been dealing with. And the way that we treat that is using chiropractic adjustments, soft tissue therapy, as well as using the prescription orthotics if need be in certain circumstances. I was first exposed to orthotics when I was in chiropractic college in Canada through a practitioner who was using, it was actually TOG orthotics at the time, using them to deal with patients that had back pain, that had neck pain, and finding that if the feet and the base of support was not aligned correctly, that this obviously could set off problems in the spine further up. At that time, TOG didn't have gait scan. We were still using foam casting, plaster casting, but the biomechanics of the foot obviously hasn't changed. Over the years then, once I graduated, I started working in other clinics that used orthotic systems, but it wasn't the orthotic group orthotics. And when it was time for me to practice in my own clinic, Advanced Chiropractic Clinic in Ireland, then we started looking at which company would we use to provide the orthotics. And by that time, it was about 5 or 6 years later, technology had progressed, everything had progressed in the world of orthotics. And in all the research that I did, I again went back to the orthotic group. The plastics had improved, the thermodynamic memory plastics that they use are fabulous, the gait scan is very easy to use. I find it very good diagnostically, but I also find it very good as an educational tool for the patients, so that they can understand what it is that you're telling them. They physically can see on the screen where their foot is not functioning normally. The first thing that I find that I use it for is the general patient that comes in with chronic back pain and that it won't improve, or that we're getting a certain amount of improvement but that I find it's continuously returning. And when I do a full assessment then and look at the feet, quite often I find an issue there. So then I would start to prescribe, I started prescribing orthotics for most patients that came in with chronic low back pain, upper back pain, headaches, neck pain, all of those things. If I find an issue with the feet, we correct it from there, and then we can continue on with the treatment through the back. The other issues that I would be involved in treating using the orthotics would be an awful lot of athletes. We do run quite a big sports injury clinic in our practice, and I find that a lot of the repetitive chronic strains and sprains of the musculature can be due to poor alignment and poor mechanics in the feet. And I've had great success over the years treating patients with the orthotics. A lot of the most common conditions that we would treat using the orthotics would be anything from limb and low back pain to sports injuries, as well as looking at alignment issues with children that may not present with pain yet. What we're finding is that if the foot mechanics are not effectively or optimally working properly, that if we can correct that, we reduce the strain on all of the joints and on the muscular system and on the spinal system above that.